I am so excited to introduce our next guest. You've seen her on some of our other videos because she is one of my favorites. Dr. Usman Singh, thank you so much for being here.
Thanks, Kristen, as always. I'm so happy that you're doing this because we all need the education.
Absolutely, and I think with families out there, they feel like they don't know where to turn, and it's so easy to just push play on a video and feel like they're right here with us.
Yeah.
So before we get started, for those that haven't seen any of our past interviews, can you talk about why you're so passionate about helping this community?
Well, I've been doing this since 1997, so I've been trying to work with families and children on the autism spectrum. And I started doing it because my own kids were having some medical issues. And as I started learning about them, it helped me learn about how sick kids present. And over the years, I have a clinic. It's True Health Medical Center in Naperville, Illinois, since 2003. I started a compounding pharmacy to help kids who are really sensitive and can't handle like excipients and things in their medicines, called Pure Compounding Pharmacy, and then just started a supplement company called True Health Naturals. So over the years, I've just been trying to learn more and more and figure out how to help these families that are struggling so much.
And you've helped thousands and thousands of families, and I don't even know how many countries you've helped at this point, because people from all over the world come to see you and seek your help and guidance. Well, today we're going to talk about, oh goodness, such an important topic, apraxia. And I think that so many families out there are very confused on even what that is. So can we talk about first, what is apraxia?
I think even families who have children who aren't talking, they don't even know what apraxia is. Because sometimes they'll come into my office and their number one complaint will be, oh, well, my child isn't talking, that they're nonverbal. And I'm hearing it more and more. And I ask them, well, has your child been diagnosed with apraxia? And they ask me, what is apraxia? Which I find I said, do you have a speech therapist? And they say, yeah. It's hard to diagnose a child with apraxia who isn't talking because it has to do with speech. And if they're not talking, it's really hard to kind of see what their speech is like. But what it is it's a motor planning issue. So if you think about how you have to plan out movements and plan out processes, 1 step, 2 step, 3 step, it's one neuron to another neuron to another neuron. And so somewhere in this process, there's a disconnect. And usually the information goes in and the children seem to process it so they understand, but they can't get it out. They can't express it. So an example I use for some of my patients is if they're trying to learn how to talk and they're trying to say the word cat, you may think that's a one-syllable word, but it takes k-at. So they may not be able to do that. So instead of saying the word cat, they may just say k. And they're trying to say cat. Well, then try to put 2 words together in a sentence or 3 words together in a sentence, or process what somebody just said and then try to put together a sentence to respond. So oftentimes the speech apraxia, this motor planning with the speech, can be seen as dyspraxia, which is in the body. So these kids will have trouble coordinating their hand movements. They may not even be able to point because they'll know where the dog is if a dad says, point to the dog. They know where that dog is, but they can't coordinate all the processes to get their finger to move to point to the dog. So that's dyspraxia. So oftentimes I'll think about, okay, why isn't this child talking? Could there be apraxia? Is there dyspraxia? And if there isn't, the treatment approach, if there is this kind of difficulty and just they trying to get the words out and they just can't come out, or they can just put 1 syllable together, then the treatment for that is different in the biomedical world, in the integrative world. It's a different kind of mindset on how do we get these neurons to connect.
Because that's really what the issue is the neurons aren't connecting the way how we're just having a simple conversation, right?
Right.
This is not a simple conversation for those that have those issues.
Yeah, and that's the theory. You know, nobody knows exactly what's happening, but that's kind of the theory, that there's some type of a a trouble with neuronal connectivity. So again, if you think of one neuron connecting to another, when we do MRIs or SPECT scans, you're not going to see any abnormality. It's not like they had a stroke in their speech center and they can't talk.
Yeah.
But there's some issue with these neurons connecting to move the palate, to move the tongue, to move the muscles here so that they can make the sounds and the words that they need to.
And we often see oral motor having issues. Like they almost feel like they have like lazy jaws. Like when they talk, it's not like even when they're trying to talk, it's more slurred because they're not actually moving their mouth the same way you and I are.
Some of them have that like issue with like, you know, some of our patients are diagnosed with mitochondrial issues. And when you have a mitochondrial issues, your muscles aren't, you have like gross motor delays, fine motor delays. Your eye muscles don't even track and move the right way. That's called strabismus. And sometimes the muscles in the mouth are not coordinating to make these words. So again, those are the types of things we need to think about when we're dealing with a child with this kind of apraxia. So you're right, like the muscles. I think of this area, I always call it the bottleneck. So if you think of the neck as a place where, you know, again, in biomed, our theories are that there's a lot of toxicity, you know, and things go in and they don't come out. Well, if things are going into the brain, how are they going to come out? Where do they go? Right here.
You're getting stuck. Yeah.
And, you know, a lot of our kids will do, you know, the ear covering, or they'll push their head, or they'll want deep pressure in their chin or their jaw area. And I see that a lot with my patients who have apraxia, that there's a lot of like irritation. They'll bite, they'll chew, they'll have that, like you said, oral sensory need to get that input. And again, this is my own theory that I just, my thought process is that something is just kind of stuck in this bottleneck area.
So how do we help get it out? It's like the ship in the bottle, right? Like how do we get that thing out when it looks impossible?
Yeah, so like I guess last year they just found out that there are lymphatics in the brain.
Okay.
So lymphatics, like our lymph system, if you think about it, it kind of goes along with the veins and the arteries, but it's a way of clearing stuff out of the body. Things end up in the lymph. And that's why when you get an infection, your lymph nodes get swollen. Because when you get an infection, your body's trying to deal with it and drain all the debris from that infection, and it ends up in these lymph nodes. Well, if you feel the neck of a lot of my patients, what we'll see is we'll feel swollen lymph nodes in the front of the neck and in the back of the neck.
Okay.
And that's a sign that there's congestion. A lot of them will get ear infections or sinus infections and throat infections. It's like there's a lot of inflammation, a lot of congestion. So you said, how do we get this out? Well, one of the things is we want to get that to drain.
Okay.
Yeah, so number one, we want to clear any infections that are here. We want to maybe do things like cranial work, or even I just tell my patients just to get some coconut oil, put a couple drops of essential oils for inflammation, like frankincense or copaiba or something like that, eucalyptus, clove, and just rub it on their anterior cervical lymph nodes, and then rub it on the back.
Eucalyptus would even feel good too.
Yeah,
I love eucalyptus.
And even just for a couple of minutes.
Yeah.
You could do it twice a day.
Wow, that's easy.
Yeah, it's super easy.
And it smells good.
Yeah, and then, you know, you just, even like massage.
Yeah.
I think we forgot some of these little things that
They're so
our
easy.
grandmas used to do for us.
Yeah.
Yeah, so, you know, and just in terms of like what parents can do, really simple things, just to drain the body.
Okay.
Epsom salts baths.
Easy.
A cup of Epsom salt, cup of baking soda in the water. Give them a little massage after that. Try to get a lot of this lymph draining. The lymph drains to the liver. And then, you know, our kids are toxic. The liver gets backed up. So I like castor oil packs.
I love hearing about castor oil packs. Let's talk a little bit about that, because that's so easy to do.
It's so easy.
Oh my, and it's cheap. It's cheap and easy.
I think when I say it to patients, they like look at me like, what are you talking about? And then
And parents can do this too, because there's so many parents that are backed up, or their liver's not doing so well.
You know how we talk about binders?
Yes.
Well, to me, we talk about charcoal and clay, but to me, castor oil is like the best binder. It's not absorbed into the body. It just binds stuff and it goes.
Mm-hmm.
So the way you do a castor oil pack is get an old t-shirt, an old flannel t-shirt, cut it about the size of a paper. You can make 2 or 3 out of a t-shirt or a shirt. Fold that in half,
Mm-hmm.
and then drizzle it with castor oil. It doesn't have to be soaking wet where it's dripping.
Mm-hmm.
Just drizzle it, and just place that on the abdomen.
Mm-hmm.
And then get something to cover it. You can use a Ziploc bag, but if you're funky about all that, you can use parchment paper. Cover it with parchment paper, and then a heating source, like a heating pad or a hot water bottle or one of those things you put in the microwave.
Mm-hmm.
You don't need to get fancy. And then just set it on top. And the heat drives that castor oil into the liver, the gallbladder area,
Mm-hmm.
and it helps to kind of pull those toxins out. And because it's not absorbed, it's not going to hit your gut and cause a big problem in the gut.
And how long do you keep it on? It's on the left side?
Yeah, underneath the ribs, like
Okay.
right where the ribs are, on
Okay.
the right side.
On the right side, sorry. I'm like mirroring, sorry, like the right side,
Right
yes.
side,
Okay.
Yeah. So this is the spleen, this is the liver.
Okay,
And,
right side.
in a little kid, it's just going to cover the abdomen.
Yeah.
So we're cool. Let's try to get it up here. And I usually tell parents, they said my kid won't sit down. So even if they're sleeping, watching TV, or
reading
doing
a book to
something,
them,
or
or-
reading a book, just slap it on there.
Like 20 minutes?
15-20 minutes.
Yeah.
And then what I do is I don't ever take that cloth and put it in the washing machine, because anything else in the washing machine is going to get kind
Yeah.
of kicky and oily.
Yeah.
So put that cloth, just wash it
By hand.
by hand with some soap and
Dry it out.
let it to dry. Yeah.
So
So
easy.
easy.
So easy and so cheap. Like, oh my gosh. And so what other things? I know your practice, you guys develop stuff to basically make our lives easier.
Well, yeah, because when I do some research on things, it kind of sets off some light bulbs. And with the apraxia, it's been a big problem, getting some of these kids to be able to get language. So we're always kind of on that trail. To get those neurons to connect, we need a lot of good fats. So healthy fats are really important for this subset of population. Those fats get oxidized, they don't work well, they don't flow well.
Mm-hmm.
So a lot of antioxidants are really helpful.
Mm-hmm.
Vitamin E is very helpful as well in this population. So those are some simple things we can do, the phospholipids. But beyond that, I developed a product called Motor Connect,
Okay.
which is to help with connectivity. And the main ingredients in that is biotin.
Mm-hmm.
Biotin is a simple vitamin that's really there's a lot of biotin in part of the brain called the cerebellum.
Mm-hmm.
And the cerebellum is your coordination center. In kids with autism, they have some abnormalities in that part of the brain, and the cells there are called Purkinje cells. So by upregulating that function, you can get a better coordination in the brain.
And biotin also helps with gut and everything else.
Yeah,
it's kind of
it
the
helps with
unsung hero.
absorption.
Yeah.
A lot of women use it for hair
and nails, yeah.
and things like that. It helps with glucose metabolism. So
It's going to help something in the body.
It helps with blood sugar regulation.
Yeah.
So, and then another study they had done in Italy on Alzheimer's patients, and they use a B vitamin called B1 benfotiamine.
Is that different than just regular B1 we buy?
Yeah.
Okay.
Benfotiamine is fat soluble.
Okay.
So it gets into the brain.
Oh, okay.
So water soluble things like regular B vitamins aren't going to get into the brain.
Okay.
But this one, a fat soluble form of B1, gets into the brain.
And do you have to have a doctor's prescription to get this?
No.
Oh, they can just go on your site.
Yeah, it's over the counter.
Oh.
And it's called benfotiamine.
Okay.
But in these studies, it seemed to help with what we call dysautonomia.
Okay.
So in the brain, there's so much excitation. So the sympathetic nervous system is upregulated.
Okay.
And you don't have that parasympathetic balance.
Okay.
And so that's called dysautonomia. And when you have too much excitation, that leads to inflammation.
Okay. Makes
So
sense.
if we can calm down that excitation,
Mhm.
we can calm down the inflammation. And when our kids' inflammation is better, they're calm.
The whole family is calmer.
Yeah,
When
can
they're feeling better,
focus, they
yeah.
can pay attention. So people say, "Oh, what can I do for my kid who isn't paying attention?" I said, "We got to get the core. We got to get to the inflammation."
Is that B1 that you're talking about in the product with the biotin?
Yeah.
Okay.
So it's interesting that biotin and B1 are always together in the body.
Wow.
They're oftentimes together.
Okay.
Yes. So they're oftentimes what we call cofactors in different
If you
pathways.
see the supplement starting to help, is it something that you see sooner than later, or is it something over time?
So it's one of those things because it's higher doses of these things. I
Mhm.
always tell people, always ease into something.
Mm-hmm.
You can kind of build it up a little bit.
Okay.
Start with a little bit, build up,
Okay.
and then come back down.
Okay.
But I obviously can't give medical advice.
Yeah.
So with these types of things, it's always best, talk to your doctors,
Mm-hmm.
talk to your clinicians, and see if these types of things are helpful.
Mm-hmm.
But it's the concept. So the
Mm-hmm.
concept is we want to kind of help inflammation. We want to kind of help that excitation. We want to help with connectivity in the brain.
Okay.
And so,
And
these
what was
are
the product called
concepts.
again?
It's called Motor Connect.
Motor Connect. I was all excited at the B1 and the biotin. I'm like, and now I forgot the name.
And then there's molybdenum because that's a cofactor. So, it's
So then
all
I was
in
like,
there.
then I forgot what the name was called. So Motor Connect. I might
Yeah.
need some of that myself.
But it's one of those supplements I developed to use for a short period of time. Let's get this piece working.
Oh, okay, so you're not
better.
always on it.
No.
Okay.
And I kind of feel that way lately about supplements too.
Okay.
I'll kind of put things in, see how they do, and then take them out and see how they do. Unless we know that we've got a big mutation or a SNP or a huge problem in a certain area. But these are all like theoretical.
Okay.
Yeah. So for theory, you kind of have to test it out,
Mhm.
see if it works.
Yeah.
Give it a little try. Take it out and see if you still need it.
I love that.
Mhm.
So Motor Connect, now that I remember, it's
Oh,
not just
okay.
biotin and B1.
Yeah, but again, with this whole approach, I always think about when kids aren't talking, what's preventing them
Well,
from
here's the thing.
connecting.
It can't, I mean, obviously we can't give medical advice, but to try something that is most likely not going to hurt if it doesn't work right away for you. As a mom of a child with autism, I'm always wanting to try something that if it makes sense, right?
Yeah.
And the fact that, like the castor oil packs, like that's not going to hurt anybody if you try it, right?
Right.
And you're trying something that has natural stuff in it. It's not going to really hurt you if you're going to try it,
Yeah, and
It's not
I always tell people there's always a potential for side effect with anything.
Anything.
If you overeat or if you overdrink water.
That's what I was going to say.
or-
Water can even give you,
Yeah, so I just think that everybody should be a little cautious when it comes to higher doses of things.
Mhm.
And so, yeah. And the fact that, with a lot of our kids, we need to figure out what may be blocking.
We have to figure out the reason. Why is that not connecting?
Yeah. Why is it? I mean,
Mhm.
there might be a metabolic reason.
Mhm.
There's a SNP in a certain channel or an amino
Mhm.
acid that's not formed. But because we see so many similar kids,
Mm-hmm.
I really think it's not genetic. I
Yeah.
mean, there's a big environmental factor. I mean, the kids in Italy or the kids in the India or the kids in the Middle East, they stim exactly the way the kids in the U.S. stim. They don't stim any differently. I mean, they do the same strange type of behavior. So again, for them to have the exact genetic
It's
issue,
impossible.
It's probably not.
It's the same way, if I've done talks in London and then talks in Kansas, and they'll say, but in London, the kids are eating that shouldn't be eating these foods because they're food sensitive or intolerant, but it's always chicken nuggets, pizza, waffles, cookies, crackers, milk, right? Or something similar to that. You can do a lecture in the UK and say that. You can do that same lecture in Kansas in the United States, and they're like, how did you know what my kid ate? And it's like,
'Cause they eat the same
yeah, and you're just but yet, and the cultures could be totally different, but yet the kids are gravitating towards certain foods that really their bodies shouldn't have because there's some type of intolerance to it, right? But it's fascinating. So when you say that the kids are stimming the same way in India.
No, it's some weird way,
Yeah.
some of them will take saliva and then they'll play with it or they'll put it on a window and they'll look at it and I'm like, who comes up with that stuff?
Yeah.
Yeah, so again, when I think about what's blocking the kids, my three biggies are toxin,
Mm-hmm.
allergen, or infection. That we just haven't.
We haven't nailed it all down yet, but it's one of those three, and it could be all three. And
It could be all three.
Yeah, and sometimes what it feels like, I don't know what that game is like. It's like the whack-a-mole game, right? So you basically, you get rid of one thing and the other thing pops up, and then you get rid of another thing and that thing, and sometimes they're all popping up at the same time, and it's insane.
I know. I call it whack-a-mole too, because I feel like, oh, I'm hitting the yeast, and then, oh, I got to hit the parasite, and then, oh, yeah, well, yeast is back, and then we're doing bacteria, and then they had a PANS flare, and now, oh, what about the viruses? And obviously there's immune dysregulation in our kids, and neuroinflammation, and it's like we got to do it all. We've got to get all that down. At the same time, we've got to work on their inflammation. It's complicated. It's complicated.
And that's what autoimmune is. It's very complicated. And for those watching, because we know that there's different subgroups. Some kids don't have these issues, but the group that we're talking about does have these issues. So when we're talking about autism, we know there's many different subgroups, but the group that we are talking about today are the ones that are suffering from other issues other than just having the label of autism. They're suffering from food allergies, they're suffering from epilepsy, they're suffering from, mitochondrial characteristics of things that are flare-ups in their bodies. So again, I want you guys to be aware that we understand that the word autism is very broad, and so the group that we're talking about, you'll know if you're watching it, that if you have these kind of issues with your child, that's the group that we're talking about. So,
and today specifically we're talking about apraxia.
Exactly.
So and this may not be for kids
just with autism. It's with apraxia. Could be, you could have somebody developing without autism and still have issues with fine gross motor or verbal communication.
Right.
So,
and there is kids who have apraxia and don't have ASD.
Yes, exactly.
And then there's a combination.
And the reason I say that, so we don't get emails telling us.
You just don't understand.
Yeah, so we do understand. So we want to make sure we give that disclaimer so everybody understands. So now, how do people find out about you? I think you gave your websites in the beginning. Can you give them again?
Yeah, so True Health Medical Center.
Okay.
So truehealthmedical.com.
Okay.
And then Pure Compounding Pharmacy. PureCompoundingPharmacy.com. And then True Health Naturals.
Okay, so between one of those three, they can find you.
Yes.
And then what message do you want to leave parents with today?
I know sometimes when I talk, it may sound like it's overwhelming and it's confusing and there's so much information. Even we're at a conference right now and my brain is just full of information. How am I going to incorporate that? How am I going to do that? What's the first step? And whenever you're thinking that or feeling overwhelmed, take a deep breath. Try to go inside yourself. Listen to yourself. Listen to your body. And just take it step by step. Because if you kind of get ahead of yourself, it's craziness. It's craziness.
I think that's great. Take it day by day, step by step.
Step by step, moment to moment.
Moment to moment.
Live in the moment. And it will unfold. It's kind of strange how that happens, but like you'll talk to somebody and then they'll send you here and then you'll send you here and then pretty soon you're like, how did I get there? But it was the right thing.
Absolutely.
Yeah.
Well, I love that. So guys, everyone that's listening and watching, take it day by day, take it step by step, and really it will unfold. And today is today. Tomorrow is always a new day. I always say that too. Like if you've had a bad moment, and there's 24 hours in a day, that bad moment might have lasted for 5 minutes or even an hour. So, anyways, everybody, thank you so much. And thank you, Dr. Usman Singh, for being here today.
Thank you, Kristen.
Until next time. Bye, guys.